Massive thank you to my Patreon supporters, Stuart Hetherington, thank you, thanks buddy, Steve Bradshaw, thank you, thanks buddy, Dr. John Venelon, thank you, thanks buddy, and the rest of the Patreon supporters. I really appreciate your ongoing support. If you too would like to be a supporter of us on patreon.com, I will leave a link below. Go ahead and check us out. Look at this. We are at $188. That is just $2,812 shy of our ultimate goal. I mean, just a hop, skip, and a jump around the corner. Hey folks, Lanky Lefty here. We're going to do a little article review. We've never done one of these before, but this one ought to be extra spicy. So we have Dr. Michael J. Bruce, PhD. Now this guy wears a tweed jacket. He has patches on his elbows. It's one of those guys. Drives around with a derby and a kerchief around his neck and his MG midget. It's that guy. Yes, that guy.
All right, settle down, people. We've got a lot to cover, and time is short.
Now, it's important to always remember that PhD, now, no offense to you guys, but PhD stands for piled higher and deeper. If you're not an MD and you can't save someone's life, you're essentially worthless to me on an airplane when someone calls for a doctor. I don't want you standing up saying I'm a doctor of education or English or literature. Okay, please stop insisting I call you doctor. So the title of this article is Why Hacking Your CPAP is Not a Good Idea. Now it could easily be titled, and probably more appropriately titled, Why Pissing Off the CPAP Community is Not a Good Idea. You're going to see here later on, the people of CPAP Talk, which is a forum, do not take kindly to this, and it is absolutely delicious. Let's go ahead and continue on. I recently read an article that was both enlightening as well as concerning, and I wanted to talk about it here on my blog. It was surrounding an Australian hacker who has taught people how to change their own CPAP pressure as they see fit. Now, what's interesting about this is they call this is Mark Watkins. I just released a video about him. He's the founder of Sleepyhead, which is now no longer active, but it has morphed or been taken over by Oscar. Now, it doesn't tell you or teach you how to change your pressure. What it does is just reports what the machine has already recorded and lets you see it. That's all it does. It doesn't teach you how to change your pressure. I teach you how to change your pressure on my YouTube channel. So the article, Why Sleep Apnea Patients Rely on a CPAP Machine Hacker, basically summarizes the work of Australian hacker Mark Watkins, whose program is called Sleepyhead, which has been showcased on a forum called CPAPtalk.com. He has created an open source, not FDA approved software, which allows a person to gain all of their CPAP information. Well, that's absolutely terrible. You can't let people know anything about themselves. In addition, this information can then be used to have people self-adjust the settings on their CPAP. I'm not seeing a problem with this at this point. The article highlights the idea that most people cannot seem to get their doctors to listen to them and continue with follow-up for the use of CPAP and the appropriate treatment of CPAP. Thus, people are now doing it yourselfing their own treatment. They use this program to see if their treatment is effective, and if not, they raise or lower their pressure on their own. I completely understand why a person might do this. It seems simple. If they happen to go into their prescribing doctor, the doctor who prescribed their CPAP, and explain their symptoms, most docs will just randomly turn the pressure up by 1 or 2 centimeters and hope for the best, when in fact they need to send the patient back in to have a sleep study to reevaluate the progression of their disease and see if they're even on the correct treatment, or at the very least, have the patient complete a retitration of CPAP to maintain pressure accuracy, and of course, recalibrate the machine. What? I don't think homeboy knows what he's talking about. Actually, what most physicians do, these are the sleep docs, is they use a clinical version. Basically, think of Sleepyhead, but it's a program that's not available to the general public. So it's Sleepyhead for professionals, which, by the way, Sleepyhead is a much better program, and Oscar is as well. It's much more user-friendly, much more easy to read. But anyway, they use this, and they find out exactly where the pressure ends up most of the night. They check for leaks and things like that, much like a patient using Sleepyhead. And they figure out what kind of is what they usually refer to as the 95th percentile, where you normally are, where you tend to end up most of the night. So no, doctors don't increase it by 1 or 2 and hope for the best. They look at that data, the same data that a patient would be looking at, and they find out what pressure they tend to be on most of the time when the leaks are eliminated, And at that point, that's where they kind of move the pressure. It's not a shot in the dark. Now, sending a patient in to get retitrated for just this is actually pretty stupid. Most people have a home auto-titrating device. And so you'd put them on a range, and again, you'd find that range of where you tend to end up most of the time. Again, controlling for leaks, and it's pretty much as easy as that. This guy is advocating for sending a patient in for an entire another night's sleep study, which is one, we can agree, a pain in the ass, and two, pretty expensive. If you're on Medicare, forget about it. It's not going to happen. They're going to do the home APAP trial. So if you get a physician that's not really believing you or jiving, or oftentimes just really don't even know what to do, you're going to be stuck there. And they're going to be like, well, hey, you're on an APAP. You have a range of 5 to 20. It'll auto-adjust to you. Isn't that why we got the auto-adjust CPAP? And you're like, yeah, I don't know. But if you go into a forum such as CPAP Talk, or even a forum like my own, freecpapadvice.com/forum, you know that doctors more often than not put you on the wrong pressure when you initially go home. And then they kind of do expect at some point the pressure to be increased, and they usually use APAP. These are the ones that know about it. And at that point, they'll dial you in. I would say 90% of doctors have no idea. They think that sending you home on CPAP, you're done. It's a wrap. So most doctors, when you complain of continued fatigue, they're just going to, check your blood, do a blood test, see if there's anything out of whack, and then try to fix that. Oftentimes they figure you're on CPAP though, so it must be being treated at that point. People in the know that this is not the case. So right here, when a patient sees this behavior from their doctor where they're simply increasing the pressure, they say to themselves, well, I can certainly do that myself, and I don't need to waste my time, money, or energy coming all the way to see my doctor, much less going back to have another sleep study, which is both uncomfortable and costly. Ding, ding, ding. That is exactly correct. They do not need to go back and see a physician to do this. They can absolutely do this themselves. Because, as we already stated before, Dr. Michael, this is exactly what you say they're going to do anyway, correct? So if this is the next step that the physician's going to take, then the patient might as well do this on their own. Doing exactly what you say, save another uncostly and uncomfortable sleep study. Now here's the problem with this, according to the article. By allowing patient to manage their own, I love this, allowing them. I allow you to treat yourself. Is it okay if I ice my arm? Can I take an aspirin? Is that okay? Mind if I do that? By allowing a patient to manage their own pressure, they could in fact cause more apnea. When a PAP device, either CPAP or bilevel, is set too high, it can overinflate the lung and cause the brain to emit a central apnea. That's actually not what happens, but sure. Okay, we'll just go with that. Which is where the brain tells the lung to stop breathing. Oh God, dude, you're making me hurt. Yeah, okay. Now, while he is correct in this is exactly what he said a physician is going to do. They're going to send you back in for a titration where it's already been blanked up in the first place. We can agree on that, right? Because they went home and it's not the right pressure. But then he says the doctor is going to just increase them by 1 or 2, which is what they're doing on their own. So what's odd to me is this guy is arguing both sides of the doctor's just going to increase them by 1 or 2, or they're going to send them back to the study where it was messed up in the first place. But the patient can't increase it by 1 or 2 on their own because only a doctor can do that. Because for some reason, if the doctor does it, it's not going to create a central apnea. But if the patient does, it will. I'm not quite getting it. Maybe he can enlighten me. He's saying this is much more serious and difficult to treat. Well, not really. Once you know you have it, so the patient increases the pressure themselves, all of a sudden they start having legitimate central apneas, which they know are legitimate because they can see my tutorials online on my YouTube channel, the Lanky Lefty 27. You're welcome, Dr. Michael. And then at this point, they can say, hey, look, this is what I've tried. I increased it to here to bilevel, and now what steps should I take? The doctor will say, oh, this is just absolutely fantastic. Or they'll say, well, let's do this first. The doctor says, how dare you take your treatment into your own hands? Shame on you. And then you go get a new doctor. Or they say, wow, this is such stunning information. Let's go ahead and at this point send you back in for a retitration, and then we can put you on bilevel in the lab. Because yes, bilevel is a little more tricky to titrate. And even at that point, we can see if these are CPAP emergent central apneas, or maybe you have Cheyne-Stokes respiration, which how the hell was that missed in the first place? But if you are at that point, you can even go on an ASV machine. This is the same reason why we do not ask patients to pick their own medical dosage with no knowledge or base of how this can help or hurt their situation. Now, this is an interesting analogy here, because in essence, how come I can't highlight that? Here we go. I have Hashimoto's thyroiditis, which my thyroid just completely pooped on me. It died. And so they do a little calculation of how much levothyroxine you should be using, or Synthroid. It came out to a certain amount. I said, hey, you know what? I'm still tired. And she says, oh, well, let's just go ahead and increase that on you because you said so, flying in the face of this. I said, can I try this one? She tried it again, said, let's do blood work. She said, okay, you're still in the high end of normal, but this is making you feel better, so let's go ahead and stick with this. And I've been great ever since. Now, at this point, she allowed me to pick my own medication dosage. She allowed this to happen. She allowed it to happen. I have no knowledge base, but she said, sure, let's give it a shot. And then if it helps or hurts, well, it's much like CPAP in that if it hurts for maybe a month, but whatever. I've been suffering anyway for like a year, as many people are with sleep apnea. So if it's under my direction, what the hell does anyone else care, right? By causing central sleep apnea, this can make a normal PAP treatment ineffective. And now you have two problems, obstructive apnea and central apnea. Not really, you're going to have one or the other. So if you're on too little pressure and you see this with sleepyhead, you're probably already having obstructive apnea, be that in the form of hypopneas or RERAs, which is respiratory effort related arousals. So you're under titrated. So you either have that and then you see that you need more pressure, and one of two things happens. You hit the mark and you're living life in Happy Town, or you do push yourself into central apneas. Oh my God, what happens then? Well, you would actually see this on Sleepyhead, and you would probably just turn the pressure back down a little bit. It's really not a big deal, Dr. Michael. Acts like once a patient changes the pressure, it's set in stone. No, it's a fluid thing. It's dynamic. You can make changes. It's not a big deal. The real issue here is that many doctors are not paying attention to their patients' needs, which I agree can be frustrating, but giving patients the keys to the pharmacy is not the answer. Well, it's not like we were exactly taking hydrocodone here, buddy. It's pressure. It's air pressure. It's not that big a deal. It's not that complicated. All right? They're not popping Norcos and Percocets, okay? We're not giving them a bag of morphine, buddy. It's air pressure. Let's not take ourselves too seriously here. The article appears to be assuming these patients are not medically complicated and very straightforward. This is simply not often the case. Actually, it is. It's like 95% of the cases that they're pretty straightforward. In the case you have a serious one, they can still do it themselves, and then that tips you off. And instead of having 2 in-lab studies, you just have 1. Sometimes even that's skipped, and they just get you a bi-level loaner machine and then titrate you at home. Majority of these patients are overweight, obese, diabetic, and have hypertension. For starters, they can get incredibly complicated for people with COPD, lung disorder. Well, if someone has COPD, you know that when they initially go in for their study, and usually on that night, they're put on bi-level. This guy, I don't think understands. He's writing this article in a place of not understanding at all the sleep field. Now, you'll see in a minute that the good people of CPAP Talk understand the sleep field extremely well, and it is absolutely delicious. By allowing a person who's medically complicated to control their pressure, they will affect their other medical issues. Sleep apnea cannot be treated in a vacuum, but must be treated with a view of the entire patient. And who knows that better than the patient? Just look at heart rate. Too high of a CPAP pressure will cause an increase in heart rate. No, it doesn't. What? So does too little of a too high of a CPAP pressure will cause an increase in heart rate. So does too little of a CPAP pressure. You're basically causing apneas. So yeah, it's going to increase whether it's a central and obstructive apnea. So you should also say too high and too little of a CPAP pressure will cause it, which is even more of an argument for a patient using a program like Sleepyhead or Oscar to manage their own care. I think they just give out PhDs to anyone who asks for one. I'm going to see about getting an online one. So what's the solution? An entire problem can be solved by using an auto-titrating PAP machine, which most companies now have available, which has years and millions of dollars of research to create an effective variable treatment protocol. This guy's a jackass. This is exactly what people are already doing that are using Sleepyhead and Oscar. What a dipshit. Okay, go ahead and get the data and then show it to your doctor. This might save you a step in needing another sleep study and get your pressure changed appropriately. Duh, stupid. This is what they're already doing. Most of them do show it to their doctor, and when they get a big fat hand to the face is when they take matters into their own hands. And the people that do go YOLO and just say, piss on it, who cares, man? Why are you trying to keep your thumb up their butt and control them? Just leave them alone. Let them do their thing. They're not going to hurt themselves. Consider an oral appliance. Oh, this is just freaking ripe. Consider an oral appliance. Yours are created by a dentist with specialized training in sleep medicine. In many cases, can be extremely effective and easy to titrate. Wrong. It's effective in people with mild sleep apnea, and even then it's like 74% effective. And it's actually not that easy to titrate, and oftentimes titrating involves pushing the lower jaw forward, mandibular advancement, and even if you do get them titrated, this oftentimes leads to TMJ, which is your temporal mandibular joint problems. You start getting headaches, and it's not a pretty thing if you stretch that out too much. It might not be the treatment, but rather your sleep habits or even some mild insomnia. Consider my oh god, then he's pimping his stuff, or my new supplement, Active Sleep Booster with CBD. It's a cancerous butt drip. That's what it is. He wants you to use a cancerous butt drip. Good. Great article, which got blah, blah, blah. Okay. This is where it's just absolutely hilarious. MDs don't know as much as they think they do. I trust a hacker more than an MD. Not sure what business a psychologist has coming on my CPAP therapy, but from a professional standpoint, I wonder if the author even suffers from apnea or even has ever used a CPAP machine. Now, my sister, full disclosure, is a psychologist. She's a PhD in psychology. Actually, I take that back. She's a master's. So she still has some level of humility about her. She has no idea anything about sleep apnea. So I really don't know why this guy, it's not like that. The master's, once you get the PhD, that's where they really focus on sleep. I doubt it. This is great. Now, this is a user on, he uses the CPAP Talk forum. He's basically giving his story. Go ahead and read through it on your own. Giving a story of how he was initially being seen by several doctors. They tried several different things. They completely dicked him up. He eventually just got the program. He started using the program, understanding it, made the tweaks himself, and all of a sudden now he's just living life in Happy Town. And then the good Dr. Michael Bruce, PhD, which is also PhD, I guess could be phenomenally hot dancer. Hey, thanks for your comments. I appreciate your support and all that stuff. I don't think he was supporting him, but I don't know why he says that. I think he's kind of being a passive-aggressive cocksucker, if I'm being honest. But he falls back on this. Hey, it's not me. This is an FDA rule. Hey, it's not my rule. This is Pol Pot's rule. He's the one that wanted to go out to the killing fields and kill people. It's his rule. I just follow it. Not my rule. Don't look at me. And then this is great. I am on your side, but unfortunately you appear to have been offended by my article simply stating that the FDA is by prescription only. Actually, changing your pressure is not anything that's FDA. It's the sale of CPAP devices. That is FDA prescription only, not the changing of pressure. Jailbreaking your CPAP is not like an illegal thing. And they're really, he's citing safety consequences. There's safety consequences if you don't change your pressure many times. So here's what he's citing as defense of his point of view. Should people be able to change their own pressure? And what if they make their pressure, their medical situations worse? Who would even know? Well, the people who take the time to download a Sleepyhead program or Oscar to monitor their own care, they're usually not buffoons, okay? The buffoons, and there are buffoons, those are the ones that just do what their doctor says because they think the doctor's always right. We know the doctor's not always right. And so what I'm suggesting is that people that take matters into their own hands are more intelligent. They are more informed about their own treatment and their own medical condition. So they're not going to get it wrong. And if they do get it wrong, they're going to do so with as much knowledge as they possibly can have. But what's most important is that they're taking it into their own hands and they are going to take an active role in their own care. And then he's going on to say that people think more is better and over titrate themselves. I just don't see that happening. Most people on CPAP Talk and on my forum, freecpapadvice.com/forum, suggest doing a 1 or 2 centimeter increase, just like he said the doctor does, and then rechecking it after 2 or 3 days. 2 or 3 days is not going to hurt anyone. It's just not going to happen. You have to remember these people have been having sleep apnea or central apnea for years and years before it's caught. So a couple nights is not going to do anything. And then this right here is just a lie. FDA says physicians should be the only ones to change it. That's not true. I'm really not sure why people are so up in arms about this. I don't get it. I don't understand. He's so oblivious. It's funny. And then here we go. Diamond. Now I know Diamond. Diamond's a good dude. Diamond will tell you exactly what he thinks. He is a CPAP honey badger. He don't give a blank. Oh, and he actually says exactly what I said. The FDA regulates the sale of PAP devices, not their use anymore than what's regulation that forces you to take any medications prescribed to you. Anybody's free to alter the dosage of anything they're prescribed. Accessing hidden menu is not jailbreaking. Oh, this dude's just absolutely magnificent. As a bugbear to, oh my God, central apneas. That's why people educate themselves so they know what is happening. And to those 1 in 7 who might actually have pressure emergent central apneas can react appropriately. Yeah, this is pretty much exactly spot on. He hits it right on the head. If it happens, then you deal with it, much like a physician if they do it in a lab or a tech in a lab. If it happens, then you react to it. But oh, these guys don't mess around. Yep, here again. Auto PAPs are not a panacea. They have to be tuned, and shockingly few physicians seem to be competent to do so. Spot on, man. And with that, the fact that you're using it to enrich and pander your own products. You know what? What's wrong with that? Hey, go ahead and visit my website. Get yourself a slightly used mask at maskbright.com. It helps support our site. We also have an Amazon affiliate link, which I can't talk about anymore. I can just let you know I have one, and what it does is just a giant mystery to everyone. So here, Dr. Bruce responds to this. I'm happy to discuss this article, but I want to do it offline. I don't want anyone to know about it. And he just gets flat ass called on it by Diamond. You want to hide the truth from people? Let's not. You posted an anti-self-help post, and then you use that as a way to slip in ads to pad your wallet. Deplorable. Well, you know what, Diamond? Call me deplorable too, because go ahead and buy Maskbright at maskbright.com. You can also get that on Amazon. Make sure you use that affiliate link when you do. Man, we can all be a little deplorable at some point, yeah? Dr. Bruce, this is from William from Rochester. Dr. Bruce, your reply is disappointing, as is your article. All faith in you is just lost. Now I find you're not even a medical doctor. Which you're just shilling for products and services. It's disappointing that Psychology Today will publish your article. Just sign me happily and healthily, controlling my own CPAP therapy. Goodbye. Now, this is probably another good time for me to mention that if you're looking for cost-effective home diagnostic sleep testing, check out axgsleepdiagnostics.com. That is my company, and we just do a fine job there, guys. We just do a fine job. Get tested in the comfort of your own home. You could just read this for days. Absolutely for days. Now you can find the link at cpaptalk.com. I will try to remember to link to it in the article, in my description here below. But these guys, this just goes on forever. He is getting hammered, and he's using these passive-aggressive techniques to try to weasel out of it. He's using his psychology degree to cover his ass. I respect that, but it's just very, 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 very transparent. Stay in your lane, buddy. This right here sums it up. You really ought to stay in your lane. Pink. Just stay in your lane. All right, guys, I'm out. If you're looking to support this channel, head on over to maskbright.com. You can pick up some Maskbright there, as well as a large selection of slightly used masks at very affordable prices. Go ahead and check it out. It helps support this channel. Now is a great time to also mention that we are an Amazon affiliate. Now, as an Amazon affiliate, we earn on all qualified purchases, so we will have a link in the description box below. Please consider using that when shopping Amazon. Then let's go ahead and mention this Patreon thing just one more time. Now, some of the benefits of joining this is absolutely nothing. There really is no benefit at all. You can look at these for free on YouTube. But if you're appreciative of our work, you can go ahead and check this out and donate monthly.